covered a lot, right? We covered immunotherapy. We went down target therapy, stage 4, all the way to stage 2, and adjuvant, neoadjuvant. Maybe you can just touch a little bit about what clinical trial is like. I know this is another big part of your day-to-day activity. And maybe you can dispel some myth for our like patients and the public.
Yeah, I think clinical trials and clinical research is part of why we have the drugs we have today. And that takes a lot of trust on the part of the patients and their families, and it really is a partnership. A lot of trials today focus on trying to come up with different combinations to overcome resistance to immune therapy and targeted therapies. I would say a lot of our focus is on immune therapy. I think one of the biggest myths, is the concept of like a placebo,
Sure.
like sugar pill. And I would just say, for patients with stage 4 melanoma, that's just really not something that's done anymore. I think on the flip side, the other thing, despite a lot of promise, sometimes there's a ton of promise. We may have even like early stage results from earlier, smaller trials. I'm always really careful to say, if we knew it was better, we wouldn't need to do the clinical trial. So there is some risk there. Clinical trials usually, require a bit more of a rigid schedule. They're sometimes not offered, widely. So they require more support and logistics on the part of the patient. And it's a real barrier and something, we're all working to overcome that, the majority, not just in melanoma, but the majority of adult cancer patients are not treated on clinical trials. And so, would love, to think about ways to continue to partner with our patients in the community and broadening that access.
No, I think you touched upon two very important area. One is access, right? And then second is there is a kind of a logistic challenge and the demand that put on patient who is already maybe ill and have to come into the center
Absolutely.
and getting blood done, getting imaging. And lastly, I think you said something very interesting, very poignant, very like sort of accurate. That is managing the expectation, because a lot of a patient is sort of so concerned. They sort of so much hope hinged upon that miracle drug in a sense. Really have to manage that.